primarily at the GYN Lounge, a lot of it is I'm not understanding what is going on. I think I'm too young for all of this menopause talk. However, I know I don't feel like myself. I'm hot when everyone else is cold. My mood is up and down. I'm awake clockwork at 3 o'clock in the morning. Things are changing with how my urinary pattern is. I'm waking up more often to pee. I'm not enjoying relations with my partner. I have no desire to do anything. This is not how I want the rest of my life to be, and I need a solution. But a friend of mine have tried this, and I tried it a little bit. It really didn't work, so I don't know what else to do. So a lot of it really boils down to quality of life. There are stages that we get to that really things should be, this is the best zone. You've been through the teen years and the 20s and all of the building, and this is the good zone. And now you're finding yourself not like yourself. You cannot enjoy all of your hard work, enjoy your children. So really, a lot of it is quality of life issues, is what I see women for.
Hey, gorgeous. Welcome to Unapologetically 50 Plus. So, today's conversation is one I think a lot of women don't even realize we need. Why women feel dismissed in healthcare. When it comes to our health, especially as we get older, many of us have learned to push through, to normalize discomfort, or to accept care that doesn't actually feel like care. But what happens when that experience is different? Today, I am joined by Dr. Adanna, a board certified gynecologist and the founder of the GYN Lounge. She created a space that reimagines what women's healthcare can feel like, more personal, more intentional, and centered around actually listening to women. We're going to talk about what that looks like, what's been missing for so many women, and why this conversation matters now more than ever. But before we get started, I have one huge favor to ask. If you find any value or enjoy the content, please remember to like, subscribe, hit the notification bell. It truly helps my channel. So thank you. I truly appreciate your support. All right, let's get this conversation started. All right, Dr. Adanna, please let folks know who you are and what you do.
Hi, thank you so much for having me in your podcast. My name is Dr. Adanna Ikedilo. I am an OBGYN here in the Central Valley of California, and I deal in women's health, surgical issues, menopause issues, perimenopause, anything that is disturbing to a woman's quality of life, I am able to take care of.
So tell me, what makes your clinic, and I use the word clinic lightly because you call it a GYN lounge, the GYN lounge.
Yeah.
What makes it so different than a regular GYN clinic?
The main thing really is access. And the GYN Lounge was born out of the need for women to have access to specific medical issues. Myself, I'm in my 40s and I've had to navigate the healthcare system even with the knowledge that I have and the people that I know, and it still was a very difficult task when it came to specific things. So when I had the opportunity to do something, I wanted to open up something that will allow women to have access when they really need it most. And typically, these are times when you really don't have the space to make an appointment and sit around or be canceled, or, you have a lot going on in your life. So the GYN Lounge really was there to serve that purpose to allow women to have access.
Okay, okay. And that kind of goes into, and maybe this is this next question might just be what you described. So, what inspired you to create the GYN Lounge, and what were the gaps you were seeing in traditional women's healthcare?
Yeah, so really is, I don't have the statistics off the top of my head, but there are more OBGYNs retiring and leaving the field than there are
Oh,
actually coming in. If you were to look at the Central Valley of California, there's probably one OBGYN for 5,000 women. So, and most OBGYNs are still practicing both obstetrics, so taking care of pregnant ladies and prenatals and delivering babies, and the gynecology. So, is one of those in thousands of women that there was not a lot of space for certain things. You really can't do it all, so you have to pick. So most people is weighted towards pregnancy because this is a very timed, very specific, and you can't say to a pregnant lady, "Well, you just wait a minute. I'll see you 2 months from now," right?
right,
If you
right.
have timely appointments that you have to get to on a weekly basis, every 2 weeks, and so forth. So what I saw really was this big gap in women that were walking around trying to take care of their families, trying to take care of themselves, struggling with things that were so fixable, so fixable. And I saw, during the pandemic when all of us had the downtime of people going online and the information that was out there that were not coming from medical professionals, these were influencers. And these were what our ladies were listening to and
Hmm.
subscribing to and trying to do what they said. And that was not right for me. So, really, my motivation was trying to serve portion of women that really needed professional help. So that was how the GYN Lounge kind of came about for me as well.
Okay. So I want to stay there for a moment because what you created, like you said, how it was created, but was there a personal experience or
Oh,
moment that made you say, there has to be something different?
yes, yes. So after I had my babies, uh,
Hmm.
I started noticing some changes, right? I have a very stressful job as an OBGYN. We barely sleep. Sleep is a luxury. You are asleep
Right.
probably 30 minutes in 24 hours, and to turn around and do it all over again day in, day out. So we're used to that. But even at my baseline, I noticed that things were starting to change with me. So I reached out to my OBGYN, to talk about a few things. And, we're colleagues as well. So as you get certain answers, but you realize that you needed a little bit more. So when I myself know how to navigate the system and I could not get the help that I needed, not that it wasn't available, but it was how I needed that help. It made me query, how about other women who have no clue how to navigate the healthcare system? How are they getting the help that they need?
Okay. Okay. So now let's talk about for someone hearing about the GYN Lounge
Yeah.
for the first time, how would you describe the experience compared to a typical OBGYN visit?
Yeah, so the GYN Lounge currently is specifically a telemedicine visit or
Oh,
platform
uh-huh.
office. So the GYN Lounge is where we take care of perimenopause, menopause concerns, hormone concerns, women with irregularities in their periods, even fertility care, just looking for consultation. But this platform is a telemedicine platform. There is an offshoot from there, which is my brick and mortar practice, where I serve thousands of women. But with those complaints from that aspect, if something is needed physically, then there is somewhere for us to go. But the neat thing about the GYN Lounge is, with technology and different EHR platforms, you can take care of your appointments yourself. So you do not need to talk to anyone. You do not need to wait in line on a phone call. You can go to the site. You can book an appointment for what is specific to you. There are different categories of appointments, be it new patient with hormonal concerns or a follow-up visit for a problem or interest in the vaginal laser, so forth. So
Mhm.
it gives women power, but also is I wanted to make sure that I made it available at a time that most women are available to take care of themselves. So is you have people that, have kids that are in school or have busy careers, and their only downtime to actually come in for a visit is somewhere after work hours. But guess what? Their work hours are our work hours. So when they're available, we are closed. So I was really driven to make sure that practice is open when women are available. So you have after hours appointments and weekend appointments. So we take Saturday appointments all day long. So
Oh,
that was the thing that's unique about the GYN Lounge. But the even more unique part is this is not a new concept in terms of telemedicine to deliver care to women. But the thing for my practice is people know me and they know where to find me versus the national types of platform is that when you go on there, you see wonderful providers that are able to serve you. When there's a problem, you have to go to New York or you have to go to New
mm,
Jersey. Is who do you go to? So
right.
it's the same one doctor per thousands of women. You have to make an appointment to speak on a complication that you had due to a treatment. So that means their next available appointment is in 6 months or 8 months.
Right.
Versus at the GYN Lounge, when you do have an issue that requires a physical examination, our next appointment is next week. I can see you in my office.
Okay. So you mentioned real quick, I heard you mention something about the vaginal laser. What
Yes.
is that
All right.
exactly?
So, the thing with women's health, it's awesome. And there are many different companies that are doing all these things, trying to improve our quality of life. Back in the day, I will say all of these things were available to just the elite, the Beverly Hills Hollywood people. But, but now is, these are things that people have been enjoying for decades. There are things that can help with symptoms that women go through that is not your traditional prescription with 10,000 side effects or things that have to be done daily and you're creaming it here and tableting it there. But vaginal laser is a way to treat vaginal concerns, especially dryness that comes with lowering of your estrogen levels, laxity of the vaginal wall after childbirth pain. It's been used to successfully treat medical conditions such as lichen sclerosis, which is something
Oh,
that many women suffer from. I had a recent conversation with someone regarding lichen sclerosis, and she said she didn't know what it was and thought it was a recurrence of yeast infection because it comes with its
oh,
symptoms of itching and burning, the most severe type that
ooh,
nothing can make it better. But
okay.
the bad thing about it is that over time, it changes the skin physically. So it gets thinner, tougher, and
Oh,
all you do every time is now tear. Even the bare activity of walking, things start splitting and tearing. But
okay.
the main treatment for that condition is topical steroids. So, topical steroids, you have to be on it on a daily basis for a long period of time. And with long term, you do have some side effects related to it. And it kind of goes through a series of it works for some time and then it may not work. But vaginal laser has been used to help with these symptoms and actually reverse a lot of the symptoms. But saying that is that yes, vaginal laser, there are many forms of it. In my practice, I have two vaginal lasers. One is known as the FemiLift, the other one is known as the Mona Lisa. And these are things that can help stimulate the vaginal tissues, increase lubrication, increase sensitivity, reduce dryness, help with urinary incontinence. So leakage of urine, mild leakage, it helps with that.
Wow. Okay. Okay. That's a lot. I never knew that. So thank you so much for explaining that. So what does luxury or I'd say concierge service care actually mean in the context of um, gynecological health?
Yeah. So, this question is very deep. Luxury really should be a thing that every single woman feels when they enter a medical practice. because truly is that you should feel that you're getting top tier quality every single time. The same as concierges. The concierge feel is you are paying into a certain level of service. So this is something that every woman should feel when they come to a doctor's office. My primary practice is an insurance based practice, and my model has always been to deliver the type of care that somebody who went to a boutique practice in France will get. So that means from the moment that you walk into my office is that you felt heard and listened. We are here to serve you. So you are coming to me for help with your symptoms, but guess what? I'm here to serve you. So I'm here to listen to you. I'm here to come up with a treatment plan that works for you. Shared decision making. So we're having a conversation. I'm not throwing things at you and saying, okay, it's time for you to go because our time is up. Is we are spending that time to navigate your symptoms and your problems to come up with the best solution for you.
Okay. So you mentioned the services, but what stood out to me is how intentional the experience is. So, what do you notice in women when they realize they don't have to rush to explain themselves or explain themselves twice or feel dismissed? Because I know a lot of us do, especially, and I'm not saying all male doctors do this. I'm not going to say that, but when it comes to speaking to, male GYN, OBGYN doctors, so what makes, how do women feel once they realize, wow, this service and this care is out there?
Yes, I would say first is uh, some disbelief, right? So you already come a little bit guarded because you're like, yeah, that's probably not going to be the case. And it's just so amazing how the visit will go from very guarded to everything just relaxes. And when women relax, everything comes out. Everything that is needed for a clinician to actually take care of you. Information that was previously withheld now coming out so that I can actually make the right treatment plan for you. And in the traditional way that we have a 15-minute, you've been in the waiting area for an hour and a half. By the time you come in, you know your time is limited. So you eliminate so much about what I actually need to take care of you. And you just go to okay, my periods are a little irregular. Okay, this, that, that. But the actual behind the scenes of how this is affecting my relationship with my kids and my partner, how I'm unable to get to work and actually be productive because I'm so sleepy because I didn't sleep the night before. So things that information I could have used to help you, you would withhold in the environment where you feel rushed versus in our environment where things are calm, relaxed. As by the time they get comfortable in the chair, they're able to really give us the information that we need. So it changes their outcome. It changes how I'm able to care for them.
So it sounds like it's not just the symptoms you're asking about. It's the whole mind, body, spirit experience
That is
and the
correct.
GYN and the GYN arena.
That is correct. That is
Okay, that's nice. That is really nice because that's so true. Because if you're not able, if you say, okay, I have 15 minutes to talk about my main problems, you're not really getting to the problem. You're getting to the symptoms, but not the actual problem. And the
yeah.
problem might be much deeper than, than just the symptoms. So that's amazing. I wish you were closer. I might have to take a 4 hour trip out there just to see
You
you
know what? I'll get a booking and
once a
I will
year.
come to you. We'll figure it out.
That's amazing. Oh my gosh. Because I know for me, I put it off and put it off because I'm like going, you
Yeah.
know.
Yeah.
And for women who have, serious issues, they need someone who's going to listen because, yeah, it's a whole thing. But
Yeah.
I'm glad you're out there. So what are some of the most common concerns or issues women come to see you for?
Yes, primarily at the GYN Lounge, a lot of it is I'm not understanding what is going on. I think I'm too young for all of this menopause talk. However, I know I don't feel like myself. I'm hot when everyone else is cold. My mood is up and down. I'm awake clockwork at 3 o'clock in the morning. Things are changing with how my urinary pattern is. I'm waking up more often to pee. I'm not enjoying relations with my partner. I have no desire to do anything. This is not how I want the rest of my life to be, and I need a solution. But a friend of mine have tried this, and I tried it a little bit. It really didn't work, so I don't know what else to do. So a lot of it really boils down to quality of life. There are stages that we get to that really things should be, this is the best zone. You've been through the teen years and the 20s and all of the building, and this is the good zone. And now you're finding yourself not like yourself. You cannot enjoy all of your hard work, enjoy your children. So really, a lot of it is quality of life issues, is what I see women for.
Okay. And that's true because when women come in with those concerns, how they're met makes all the difference,
That's correct.
So, how do you approach patient care differently from the traditional model?
Yeah, so primarily, it's listening. So getting a very detailed history ahead of time and then getting to know the woman. At times, our treatment plans can be influenced by culture, by religion, by women's their desires. So really is getting to know that person and having that time and space to do so. We still offer every single thing that a traditional gynecologist would. What is evidence based? Because sometimes, when things are online or not your traditional brick and mortar type of practice, people think, you're gonna make me do 5 hula hoops and, inject bee serum into my skin to get things better. But no, we still take care of you in an evidence-based manner, and we offer things outside of what traditional medicine will give that can get you there even closer, so or faster. So things like I mentioned, the vaginal laser, we have the platelet-rich plasma that can be injected in
Mm.
sites to increase sensitivity and to increase the pleasure of relationships with your partner. We have so many other offerings, but saying all that really is having a full fledged of things that we can use to take care of you. But it starts with listening and getting to know you. It's a relationship. And that's the thing sometimes that is missing in healthcare is that we have one visit and then the next is in your next annual. Okay, how am I supposed to know you if you only come to me once a year?
Right.
So it's having that space of forming a relationship with your healthcare provider.
Now, would you suggest when women come in, and I try and do this for myself because there might be so much that has gone on. This might be their first visit with you, maybe keeping a journal or writing things down. Because I know I go into the doctor's office, and again, yes, 15 minutes is never enough time, but I'll sit there, I'm like, they'll ask, okay, so what's going on? And my mind just goes blank.
Yes.
When I was at home, I knew everything that was going on, and then I get there and I'm going, I don't remember.
Right.
So, I mean, what about, would you suggest women, especially if they're having a number of different issues they want to address, keep a journal, write it down ahead of time, and just so the process can go smoother and they don't feel flustered?
That is a really, really awesome tip. And that is something that we enjoy because it makes my job a lot easier to take care of you and that your needs are met when you're in front of me. And as you say, that is, I have on my cell phone, I do have my own personal list of what I write down all throughout my day, what is bothering me, what I would like to address next time I go to my doctor's office. So in that way, I have something to reach for. So yes, it is very, very important for you to journal and to write things down. So your visit is a lot more tailored to you. Saying that as well, as a gynecologist, we've had a lot of misconceptions about time with our patients. A lot of women will wait for the one annual visit that they come into their doctor to bring their complaints to us.
Yeah.
And the unfortunate thing is that that visit is nowhere close to what is actually what you need in terms of problem visit. This is a well woman visit, a screening visit. So, a screening visit, we have to get through a number of different things that have already taken up 80% of the time. So the 20% that is left, if you start with your problems, we probably may touch on one thing. So my encouragement is, again, forming a relationship with your physician and your clinician team really is knowing that this is something that you need to schedule all throughout the year. When you call a doctor's office for an appointment, there's no rule that you can only make one at a time. You can make, I'm due for my wellness screening examination appointment. So that one can be made. The second one can be made a couple months after, 2 weeks after, 1 month after to address this specific symptom that I am having or a problem that I am having. So it's really given that space, and that starts with you as well, making your appointments as appropriate as possible.
If this conversation feels familiar or it's touching a part of you that knows something needs to shift, I've created spaces for women navigating this exact season of life. From live conversations to more personalized support through coaching, everything I offer is centered around helping women reconnect with themselves in a more honest and intentional way. If you want to learn more, the links are below. Now let's get back to our conversation. What does it take to rebuild trust with women who have had years of not feeling heard in the medical spaces?
Yes, I would say that is a very difficult one, but really this is for the physician community is that we have to get back out there, show our faces, show everyone that we are human, we are going through the same journeys that they are, and opening up the space for us to have more conversations.
Mhm.
So is to know that we took an oath, we sacrificed our teen years, our 20s and 30s to be capable of having the knowledge to take care of women, and that that is our primary goal. So it really is being out there and people seeing us for who we are, but truly is having that conversation and modeling your practice in a way that is more inviting so women know that they are able to come in for specific things, not just when they're pregnant.
Right, right. Now, you talked about menopause and so forth. So, what services do you offer women that might not even realize are available to them, especially in that area of maybe the menopause area and,
Yes.
perimenopause and so forth?
Yeah, so they're evidence-based medical treatments for perimenopause and menopause, and not everything circles around hormones because that's there are a lot of misconceptions and misinformation
Mm.
about hormones. So a lot of women come in and say, well, whatever we talk about, I just know I don't want hormones, which is fine. But the great news is that there's so many other options that don't involve hormone replacement therapy. So there are options that target specific symptoms. So, say for instance, the hot flashes, there is an NK receptor agonist that helps the brain's thermostat recalibrate so that you are not as sensitive to the even slight changes of body temperature. Is with hot flashes, how that works is your thermostat is off. So your body temperature goes up by zero point 0.1. Your body will feel as though you just got placed in an oven. It wants to release heat. You flush and you sweat it out trying to cool yourself, all of the above. But there are medications that target that specifically. Uh,
Hmm.
when it comes to sexual wellness, which is a big one, there's a normal, natural. All of this is normal and natural progression that happens is reduction in your estrogen levels over time. It is tied into your fertility, which means after a certain point, pregnancy is no longer a possibility.
Right.
Once we get there, that means our estrogen levels are also declining. There are a lot of symptoms that may come with that, but there's a few percentage of women who go through it without a peep of anything. However, the one thing that will continue to happen is that decline in the vaginal tissues that will result in things, painful intercourse, recurrent UTIs, leakage of
Mm.
urine, vaginal infections, and so forth. So, apart from hormone replacement in the vaginal tissues, like we touched on previously, are vaginal laser procedures or the platelet rich plasma procedures that can be done to try to restore and to maintain what your body's resources have.
Oh, okay. Okay. So let me ask you, why do you think so many women normalize discomfort and pain, or that just I'll just deal with it when it comes to their bodies?
Yes, really is. A lot of it is what has been passed on. So it's at times ingrained in a woman's DNA, right? This is how it is. Why is it the way it is? I really don't know. We
That's
kind of
just the
got
way it is.
that's just the way it is. My mom went through it this way. My grandma went through it this way. As a woman, this is the way it's supposed to be. So it's that normalization for us, from family members, from coworkers, from friends, that, well, everyone is dealing with it. Therefore, I have to deal with it as well. It's a phase.
Ooh, yeah, that's yeah. I used to hear that from my mom. Just hey, that's just the way it is, and she dealt with it. So I learned to push through and just deal with it. But yes, that's so much. It's conditioned and ingrained in us. By even what we see, our environment. So, a lot of women, especially in midlife, have had years of not feeling heard in the medical setting. What have you seen when women finally feel safe enough to speak openly?
Just the release and the ability to be taken care of well. Is these are women that they enjoy coming into the doctor's office. They
Oh,
bring us baked goodies and all that, but they walk away with a solution that actually pertains to them. So it is such an amazing experience when I see my patients that enjoy coming in. They know us by names, they know all the staff. And when you are taking care of them, you can see the effect of it. They are so much happier. They're out there serving the community, they're serving their families in a better way. And us women, we're pretty much the backbone of everything. So
that.
we are good. The whole community is good. And you can
Exactly.
see it in the work that they continue to do when they themselves feel great.
Okay, so I want to stay with that for a moment because so many women listening are navigating, in my demographics, people that are listening to my podcast are navigating changes in their bodies. So, what are women not being told about this stage of life that they really deserve to understand?
The major thing, honestly, is that there are solutions that can give you better quality of life as you navigate a very natural process. So you do not have to suffer through it. There is an endpoint, but we do not know when that endpoint will be. For some people, it's a few years. For some people, it's a few decades. But taking care of your symptoms does not make you weak. Taking something or doing something does not mean that you are cheating the system or you are causing harm to your body, or the effect of feeling good is that there is a bad that is going to happen to you. And that was a lot of the fears that surrounded some of the research that came out years ago, which was what drove women away from certain treatment options, was that fact that, hey, yeah, those women felt great and they were doing well, but guess what? They got cancer. So that feeling that being good to myself and feeling great and doing things means that there's going to be some consequence later on. And
Yeah.
that is so not the case.
Okay. Okay. Yeah. Because I used to hear a lot about hormone replacement therapy and so forth. And I started using bioidenticals And, it worked for me. It doesn't work for everybody. Some women say, I'll just go through without any of the hormone replacement. I said, you got to do whatever works best for you.
You, that's
So, but yeah. So, how does the environment, this setting, and the way care is delivered impact a woman's willingness to advocate for herself?
Yes, it's like you touched on a lot about um, some trauma that people have and some uh, experiences that they come in guarded. So they limit what they are able to disclose, and that really affects the way that we are able to take care of them. But in an environment that is relaxing, that is open, they are able to open up more to us. And therefore, what they tell us, we're able to tailor something for them. Like you said, is, when we talk about bioidenticals and it can work, that it can work, it just needs tailoring. But is when women come in and they're guarded about symptoms and their concerns and what they know about it, and they know it's not what they want to do, it's still in the best environment opens up the conversation for anything else you can do. So your aim is not for someone to walk away with that specific treatment that is top tier that's going to help them. The aim is for them to leave and feel great. So whether it's with that particular treatment course or something else, is the environment is not to be pushy. It is to listen and allow us to come up with a plan that works specifically for you.
Okay. What are some of the biggest misconceptions women have about their bodies as they move into their 40s and 50s?
Yes, is that, like we said, is the way it's supposed to be. So once you get to a certain time, that your body is supposed to undergo these changes, and because it undergoes these changes, is there's really nothing much that you can do about it. It's just a phase of life, and you have to adapt. So that is so not the case. Especially, sexual health is probably the one thing that I deal with very often. And I have ladies in their 80s and early 90s that are still having very healthy sexual experience. So there is not, you have so much tools available, and science have evolved that we do not have to just accept certain things as just the way it is that no, it can be changed. And the earlier, the better. The earlier you are aware, the earlier you get on a treatment plan or a preventative plan, the better in terms of how much longer you can keep things in a certain way.
Right. We don't have to accept, oh, you hit 50 and 60, that, okay, you're done. That's it.
Yeah.
You don't, just hang it up and
Yeah, not at
sit
all.
down somewhere. No, we don't have to accept that anymore. We have, as long as we have the knowledge and wonderful doctors like you who are willing to truly listen to what women are going through, what your patients are going through, and give, give help that is that feels comfortable for them, then yeah, you can have a long healthy sex life,
Yes.
period, end of story. So that's amazing. In your experience, what does true patient-centered care look like beyond just treating the symptoms?
Well, patient-centered care really is, like the word says, is patient-centered. That means the patient is the main priority, and all of the things that we are doing is to serve that particular individual. So it really is delivering care that is specific to that woman and specific to her needs.
Okay. So for the woman listening who is recognizing in herself who's recognizing herself in this conversation, what is one shift she can make starting today to advocate for herself differently when it comes to her health?
Really is going to be looking for physicians and clinician teams that align with your values. So, through insurance companies, is people always feel limited. I only have to see this doctor. Everyone is different. The same way, we all have our personalities, is that doctor teams, nurse practitioners, PAs, we all have our personalities. And you may get along well with somebody and may not get along well with the other person. Not that those people are bad, but just it's a difference. So really is finding the right team for yourself. So is finding that right space that you can advocate for yourself and you can have an open conversation and know that you are heard. But truly is making that steps to say, well, I have this doctor, I always see them yearly. All they do is this, okay, but I'm due, I'm gonna go in next year. No, find someone else.
Find
Find
someone else.
someone
Yeah.
else.
Yeah.
You can shop around. There are many of us. We're all over the place. There are people
Yes.
who, they advertise and you can see their names in places, but there are other people that they have been serving women quietly in a little corner somewhere. So you will ask your friend that smiles all the time, who do you see?
Right.
And they will
Exactly.
let you know.
So, if a woman is listening right now and feels dismissed or overlooked by her current provider, what would you want her to know or consider?
Yes, really that is not the general that's not how most of us practice medicine, or that's not a representation of all doctors. So if you yourself you're not feeling heard, if you tell your provider that, hey, there's something really important that I wanted to discuss with you, and you're not getting that welcome feeling that yes they are willing to take care of you, then you need to go elsewhere. Is you cannot, I don't know what the term is, you can't force a situation, right?
Right, right.
So you cannot expect something of someone that they're not capable of giving to you. So you
Exactly.
have to move on and you have to go find yourself that perfect team that works for you.
Exactly. So I really appreciate this conversation, Dr. Adana, because it's not just about healthcare. It's about our experiences as women, in our bodies and our minds and our spirits, and what we've been taught to accept. So I truly appreciate you coming on here. I'm gonna have to look you up because I got to figure out how to get to you because your services sound amazing, and even though you're not right around the corner, it might be worth making the trip to
I
come
look
see
forward
you.
to it. I will make it happen.
And I have one final question for you. If
Yeah.
you could change one thing about the way women experience gynecological care, what would it be?
Honestly, is the one major thing is the correct information and the empowerment of women to know that you don't have to take it as it is given to you, right? There's always options. There are always options. And we do things at times that is what we do routinely. And we don't talk about the things that we don't do routinely. So if you feel that your care is not the right care for you, or you require something a little bit extra for things that other people would, it's no biggie for them, please talk to us. One of the major things that we are struggling with right now really is the perception of procedures done to women in the office. Something as simple as a pap smear, has always been known to be something of discomfort for many women. Some women, it's not a big deal. However, it's a 30-second process that a lot of women have to brace themselves for a year. But that conversation of having that treatment team that you feel comfortable talking to, you can let us know. We have options of how to do it. We can
Mhm.
pre-medicate. We can do it in with the different sizes of spec. There's so many things that we can do to make that experience more comfortable to you. But really, it is the ability for patients and doctors to have a relationship. That means it's a two-way street. We talk, you talk, I talk, and we come up with what is going to work best for you. So conversation.
Conversation. And I do have one last question I wanted to ask. Now, do you accept insurance or is it just all, cash base?
No. So, okay, on the initial inception of the GYN Lounge, and business of medicine is a whole other conversation, is that things
Right.
have not been very fair for professionals that have spent decades learning the craft and here able to take care of women. So on the initial start of the GYN Lounge, it was easier with less manpower to have it just be a cash-based service. I quickly moved away from that because I realized that that was becoming a barrier for women who really needed this service. So, yes, we do accept insurance, major insurance we're contracted with. There's some insurance that we're still under the process of being contracted with, but your Blue Shields, your Cignas, Aetnas, we are contracted with insurance. So, you are able to use insurance for that telemedicine care. What I have done is, again, the barrier to healthcare is going to be a lot of people don't quite understand their insurance. So you can have a very large deductible, which means your insurance expects you to pay all this out of pocket first before they will cover. It's not that it's not covered, but this is your own personal responsibility. So we do a great job to make sure we know what that actually means for you. So when you book your appointment, you're going to get an estimate sent to you to say, for this visit, this is how much you will need to pay for this visit. So if it is something that does not work for you, then you are able to move your appointment, cancel your appointment, or make arrangements for payment. And we offer financing through Cherry. So you are able to utilize that to pay for your
Oh,
co-pays or your deductible. So I've tried to make it as to remove all the barriers. So the price barriers, the time barriers,
right, right.
the availability barriers, the ability for you to schedule your appointment barriers, the phone call up and down, being on hold barriers is really cleaning up all of those stuff. So yes, we accept insurance and we try our very best to give you a cost estimate before you even come in for an appointment so you are aware.
Okay, and I lied. I have one more question.
Yes,
So, the telemedicine part of it. So,
yes.
are you able to help women out of state, or is it just within California? Because I know of the yours. I was going to say certification, but you know what I'm
Yeah,
trying to
I
say.
medical license, yes.
Yeah, your license.
So
Uh-huh.
I am like a couple months shy of a year old with the GYN Lounge. And my goal was to get a very good base in the state of California before I expand past California. So currently, I am serving women only in the state of California, but I do anticipate that I will be moving outside of the state of California as well.
Okay. Okay. Good. Good to know. So, ladies, give her some time. She might be coming to a state near
That's
you.
right.
Dr. Donna, thank you so
Thank
much
you.
again for coming on and giving us so much wisdom and information about your practice and what women should be looking for in their own GYN and, advocating for yourself, communication, all those good things that sometimes we shy away from because we look at the doctors like they know everything, so we're just sit here, we're
A sponge, just
us
absorbing
right absorbing what they're
information.
telling us, but we
Yeah.
have to be willing to advocate for our health in a much stronger way. So thank you again for coming on and sharing with us.
Thank you so much.
Ladies, her information, I will make sure her information is in the description below. Please, check her out. Go to her website. She has an amazing website, so please check it out. And those of you listening who are in California, check her out. Hit her up on her telemedicine. It sounds like she has an amazing practice. So thank you again, Dr. Adana. And ladies, I will see you again real soon. Bye.